If you've noticed some curvature developing and you're not sure whether it warrants doing anything about or whether it might simply resolve on its own, I want to give you an honest answer because this question deserves one. Let's start with what most men want to know first. Does Peyronie's disease ever resolve without treatment? Yes, but less often than most people hope. A follow-up study of nearly 100 men with Peyronie's disease found that 13% saw genuine resolution without treatment, 47% stabilized, and 40% experienced progressive worsening over time. The pain from the acute phase does tend to ease, which can feel like the problem is going away. In most cases, the underlying plaque and curvature remain. So the question isn't simply whether your symptoms are mild, it's which phase you're in. Peyronie's disease moves through two phases. The active phase, roughly the first 12 to 18 months, is when the plaque is forming. Curvature may still be changing, and treatment is most likely to influence the final outcome. Once the condition enters the stable phase, the plaque has calcified and the deformity is more fixed. This is when spontaneous resolution is unlikely, and when treatment is working with what's already there rather than limiting how severe things become. The reason this matters for men with mild symptoms is straightforward. Mild curvature in the active phase is a situation where conservative, non-surgical treatment, specifically focused shockwave therapy, can genuinely make a difference to the long-term picture. The same mild curvature 6 months later, now in the stable phase, is a different clinical situation with different options. Watchful waiting isn't always wrong. If your symptoms are genuinely minimal, intercourse is unaffected, and you're actively monitoring rather than simply avoiding the question, a brief period of observation is reasonable. The NHS reflects this. Mild cases that aren't causing problems don't always require immediate treatment. What isn't reasonable is allowing the active phase to pass without assessment, because that's when the window for intervention is open. For men where curvature is changing, pain is present during erections, or the psychological impact is already affecting confidence and intimacy, the right move is assessment rather than waiting. Our initial assessment looks at the phase of your condition, the extent and location of the plaque, your baseline erectile function, and what a treatment plan would realistically look like for your specific case. If the assessment concludes that monitoring is more appropriate than treatment right now, that is what we'll tell you. A free informal chat is the starting point. No commitment, no pressure. The link is below.